India is currently managing some of the most expensive health initiatives on Earth. We are pouring billions of rupees into AI-driven dashboards and massive server rooms, monitoring the health of over 1 billion people through real-time data streams. Programs like Ayushman Bharat and the National Health Mission launch with immense political capital and significant budgets, promising to provide universal coverage across the subcontinent. But these glowing monitors hide a complex reality. We have to ask if these tracking systems are actually making the population healthier, or if the system has simply become highly efficient at generating positive data. Public health success lives in the experience of the citizens. It is found in the moments when people feel safe, treated, and protected by the institutions around them. The last decade has seen a physical expansion of the healthcare system. Expanding budgets allowed for the construction of new infrastructure, ranging from local clinics to these massive regional AIMS hospitals. Over 20 years, mortality rates steadily declined. The infant mortality rate dropped to 28, while maternal mortality fell to 97. This third line tracks under 5 mortality, falling to 34. These programs successfully met the baseline survival goals. These wins required the physical labor of millions of health workers who conducted door-to-door immunization campaigns and aggressive maternal tracking to keep children alive. If you limit your view to these specific indicators, the trajectory of the health system suggests a successful, large-scale revolution. However, these historical victories are increasingly disconnected from the current clinical reality. In many district hospitals, the daily fight for survival remains desperate. Crowded wards and strained resources tell a story that the national-level statistics often overlook. This pie chart illustrates a massive shift in how people are dying. Non-communicable diseases, such as diabetes, heart disease, and cancer, now account for 62% of all mortality in India. The gaps in infectious disease control are equally stark. This bar chart compares the National Tuberculosis Elimination Program's goal against the current reality. The target incidence was 77 cases per lakh, but the actual incidence remains at 199. This statistical gap represents over 400,000 Indians who still die from tuberculosis every single year. We are living through a paradox. India possesses advanced tracking dashboards, yet the country still carries one of the heaviest disease burdens on the planet. This contradiction exists because of a gap between public health indicators, the activities the system tracks, and actual outcomes, the health of the patients. High numbers of institutional deliveries look positive on a spreadsheet, but this maternity ward shows the reality of that data. Simply bringing a patient into a building is different from providing them with sanitary, high-quality care. Underpaid frontline workers often spend their time logging numbers into physical registers to meet administrative quotas, leaving them with less time to provide actual care to their communities. On a form, achieving a 90% screening target is a success. In a village, that number is meaningless if it doesn't result in actual disease protection and follow-up treatment. The system is engineered to funnel success stories upward to politicians, a design that often leaves little room for the voices of the patients at the bottom. The government's own 2017 National Health Policy includes a specific goal to build trust in public health systems. Explicitly stating that trust needs to be built suggests that the government knows trust is currently missing from the relationship between the system and the people. This gap in trust is visible at local primary health centers. Many patients bypass these local facilities because they are either unaware of the services available or they doubt the quality of the care they will receive. This is the ultimate blind spot of the data dashboard. Nearly 80% of citizens are completely unaware of the health services they are legally entitled to use. A dashboard showing 100% coverage is an administrative achievement, but it fails to capture whether the community has the awareness to access those services or the trust to rely on them. Moving forward requires a systemic pivot. We have to move away from measuring simple coverage and begin measuring the quality of care and the trust of the community. To find the ground truth, you have to leave the server room and ask a family in a rural village if the program actually saved them from financial ruin during a medical crisis. Without ground truth validation to challenge digital reporting, India will continue to build administrative infrastructure while the underlying health of the society remains unchanged. If you are a policymaker, an administrator, or a doctor, you must answer one question. Are you working to improve the numbers, or are you working to improve human lives?